Hi, before I begin, if you speak French, tonight at 8 p.m. Paris time, I will be live on my French YouTube channel about this topic. If you don't know me, hi, I'm Corey. I have hypermobile Ehlers-Danlos syndrome and a medical life that takes a lot of space since always. To say that I've seen at least 100 medical professionals, it's an understatement. Some were good, but some were really, really bad. So today, I'm gonna give you, the medical professional, the advices that would have helped me as a patient. And I'm sure it would help everyone, truly. Number 1, stop assuming that the patient is lying or that it's just anxiety, especially for the youth, women, non-white people, and probably other minorities or discriminated groups. A treatment can fail, a pain can be invisible, and that doesn't mean that what's happening isn't real and shouldn't be treated with the same care as any other condition. Number 2, you probably had many years of study to do what you're doing, but that doesn't mean you know everything. Especially about Ehlers-Danlos syndromes, your patients probably know way more than you about this condition. Admitting that you don't know does not make you a bad person or professional, quite the opposite. Most of us prefer when you are honest than those acting like deities and are stubborn about their beliefs instead of working to see what is actually going on. Number 3, be patient and compassionate. I know you lack time and have to do things quickly to see other patients, that you are stressed, and that the medical system is failing you like it's failing us. And in that situation, because you're human, you might get annoyed when patients are telling you details that you don't think matter because they want to be sure you understand how much they are suffering or worried. Being empathetic, saying that you understand that the situation is difficult, will help your patients feeling heard. And then asking them what they need, how concretely you could help them, will most of the time help both the patient and you to have an effective session. Number 4, please be careful with your medical notes and be sure to reread yourself. Like I said, I know you lack time, but I've seen so many doctors crossing wrong information about me that had an impact in the way other professionals were talking to me that I have to insist. Especially if you're seeing multiple people in the same family, you might be tempted to copy-paste to save more time. But be sure that you're saving the right information for the right patients, that you're sending the right letter to the right doctor, and so on. Because not doing that will in the end ask you more time and energy with annoyed patients asking you to correct your mistakes. And they can be huge. As an example, because of a misunderstanding of someone in my family and a bad copy-paste, many of my 2016 medical records mention that I'm mentally retarded. You can see what I meant about the impact of all other medical professional acts in a situation like this, I'm sure. Number 5, the medical secrecy must be respected. Seriously, I've seen medical files concerning my family disclosing really sensitive information that were judgmental, by the way, about me and my mom to my sister's dietitians. And one of my previous PT has told me that the first months of session with me, he was suspicious of me because someone he knew at the hospital told him that I was hysteric and manipulative. The context? I was a scared 15 years old teen sick after back surgery and with depression that insisted to call my mom at night. So really, be careful with the words you choose to talk to your colleagues about your patients, because in the end, it affects our lives, with rumors twisted and being spread to others. The chronically ill and disabled community is, most of the time, traumatized. We shouldn't be on our guard or avoiding medical appointments, but sometimes, because of bad experiences, that's what happens. For a long time, in my late teens, I didn't have proper medical care for that reason. Yet, earlier and better the medical cares are, better is the quality of life of the patients. But I'm sure you already know that. The community has probably a lot more to say, so be sure to check the comment or check others people's content and continue to do the best you can to do your job and be a good human. The fact that you watched this video entirely is a sign that you are in the right path. Thank you to all the medical professionals for your good work. Without you, a lot of us couldn't properly live. And to my fellow spoonies out there, lots of spoons and see you tomorrow. Bye!